Hi, welcome to the talk show. I am the medical head of the Ashoka Medicover Hospital, Dr. Akarsh Chaudhary, and our guest for the day is Dr. Nilesh Wasekar and Dr. Sudarshan Pandit. They are from the Hematology department and they both are specialists in bone marrow transplant. Welcome to the show, sir, please.
Thank you.
My first question is to you, Dr. Nilesh, is what is bone marrow transplant?
So basically, bone marrow transplant is a procedure where we transfer stem cell of normal healthy donor to the patient. For example, if patient is suffering from some of the hematological disorder like plastic anemia or blood cancer, what we are doing is we are collecting stem cells from a donor and we are trying to give those stem cells or infuse those stem cells to the recipient. And this is a lengthy procedure. Basically, it expands for a period of around 15 to 20 days, and here there is no surgery is involved. Only you collect stem cells and you give something called conditioning to the patient, and followed by that stem cells are infused. This is a basic overview of bone marrow transplant.
Okay, thank you for your answer. My next question is to Dr. Sudarshan Pandit. Why does we need a bone marrow transplant, and what are the requirement does a hospital should have to have this type of transplant?
Okay, so basically the indications for bone marrow transplant are basically in hematological disorders. As we see in benign disorders like aplastic anemia, in aplastic anemia there is urgent need for bone marrow transplant to cure the disease. And in malignancy we have AML, acute myeloid leukemia, acute lymphoblastic leukemia, myelomas, lymphomas. So there are various indications even in thalassemias and sickle cell anemias also. For curative options, the bone marrow transplant, or rather we say stem cell transplant, is the only treatment modality as a curative options.
Okay, and sir, what are the different type of transplants of this bone marrow?
Okay. Broadly, bone marrow transplant is divided into two types. One is autologous transplant and one is allogenic. Autologous transplant means when you collect stem cell from same patient and then infuse those stem cell to the patient only. Like stem cell, you need not collect it from other donor. For example, in some patients of multiple myeloma or lymphoma, you can collect their stem cells once you control the disease, and after controlling the disease, stem cells can be easily collected, and then we need to do a transplant for that patient. So this is a type of autologous. In allogenic transplant, we collect stem cells from a donor. Donor can be from your family, like it can be your brother or sister, or sometimes you can collect the stem cells from a half-matched donor, that is your mother or father also. Sometimes when the donor is not available in family, we can collect it from the registry. We have 2 to 3 registries working in India. So that transplant is called as matched unrelated donor transplant or MUD transplant. So these are the broad types of bone marrow transplant.
Okay, thank you. And my next question is to you is how does this bone marrow transplant work?
Okay, as sir said, there is a collection of stem cells. So before infusion of stem cell, we have to prepare the space for this stem cell to lodge. So for the patient, we are giving chemotherapy known as conditioning chemotherapy. In this conditioning chemotherapy, we prepare this stem cell to lodge. And after the conditioning chemotherapy, there is infusion of stem cells, and these stem cells will be accepted by the patient and will grow by itself, and by around 10 to 14 days this stem cell will grow and will start functioning their own cells, and this is the basic nature and basic procedure of bone marrow transplant. So for that, for this procedure to happen, we need special HEPA filter rooms. So these HEPA filter rooms are not available everywhere. So these HEPA filter rooms are we called as bone marrow transplant procedure rooms. These rooms are available in our Ashoka Medical Hospital, and we are all well equipped with these rooms and these facilities in our Ashoka Medical Hospital.
Thank you, and thank you for your precious time. That's all for the day. Thank you.